That probably is a $6.4 billion question. I think that there are multiple mechanisms of resistance that can develop. I think increasingly we understand that at the time of diagnosis, there are, many patients have also activation of other MAP kinase pathway alterations, and those tumors may be relatively resistant to standard treatments such as trastuzumab and chemotherapy, with or without pembrolizumab. But it's also clear that there are mechanisms of resistance that emerge, and probably one of the most well-established mechanisms of resistance is actually loss of HER2. So I think as a starting point, our group typically will biopsy a progressive lesion at the time of progression on trastuzumab-based therapy to confirm that HER2 positivity is retained. If HER2 positivity is lost, then certainly it does not make sense to target HER2 anymore. But if HER2 positivity is retained, then in the second line, drugs like trastuzumab, deruxtecan are now approved, and certainly there are any number of experimental treatments that one can consider as long as the cancer cells remain HER2 positive.